That sudden, frustrating, and, let's be honest, painful feeling. If you're one of the millions of people who've had a UTI, you know exactly what I'm talking about. For centuries, people looked to nature for answers. But now, in an age of powerful antibiotics, do these ancient herbal remedies still have a place? Today, we're going to dig into the science and see what we can find.
And with everyone talking about antibiotic resistance, the search for alternatives feels more important than ever. So, are these herbal traditions just old folklore, or is there some real, solid science behind them? Let's get into it.
All right, first, just a quick refresher on what we're even talking about. UTIs are basically infections, usually bacterial, that can pop up anywhere in your urinary system. We're talking kidneys, bladder, you name it. They affect millions of people every single year, and because they can be so stubborn, it's no wonder people start looking for anything and everything that might help.
And this is exactly why it's such a huge topic. We're not talking about some rare, obscure condition. For more than half of all women, a UTI is a painful reality at some point. That number is massive, and it's precisely why the search for effective treatments, both conventional and alternative, is so incredibly important.
And that search so often leads us back to tradition. I mean, think about it. For thousands of years, long before we had modern pharmacies, people relied on plants for medicine. So the idea of using herbs for urinary health isn't some new trend. It's a practice that's deeply rooted in cultures all around the world, passed down for generations.
And you've probably heard of a few of these, right? Cranberry is the big one, of course, but other herbs like uva ursi, also known as bearberry, horsetail, and even things you have in your kitchen like parsley and garlic have all been used traditionally for their supposed benefits.
So how are they supposed to work? Well, one of the main ideas is actually pretty simple. A lot of these herbs are considered diuretics, and all a diuretic does is make you pee more. The thinking is, hey, if you increase the flow of urine, you can help physically flush the bacteria out of your system before it has time to set up shop and cause a real problem.
So yeah, herbs like parsley, uva ursi, and horsetail are classic examples of this diuretic idea. It's all about cleansing the urinary tract by, flushing it out. It's a pretty intuitive concept, but the real question is, can the science show they do more than just that?
This is where things get really interesting. We're going to move from tradition to a specific scientific study. Back in 2006, researchers in Iraq wanted to see if thyme, another one of these ancient herbs, had any actual antibacterial power against the germs that cause UTIs. So they took bacteria samples directly from patients and put them to the test.
Now check this out. The inhibition zone you see there is basically the area around the substance where bacteria just could not grow. A bigger number means it's a more powerful bacteria killer. And against E. coli, which is the #1 cause of UTIs, the thyme extract created a 14-millimeter zone. Penicillin, only 8 millimeters. So in the lab, head-to-head, thyme was actually more potent.
The researchers themselves were pretty optimistic. They concluded that these extracts could potentially be used instead of antibiotics. But, and this is the most important part, they added that critical warning. This needs further clinical studies in details. And that phrase right there is the perfect pivot to our next section. Because what works in a glass dish in a lab is a completely different world from what works inside the complex, messy, amazing system that is the human body. Seeing promising lab results is a fantastic first step for sure, but it is absolutely not the final word.
Just think about it for a second. When you take an herb, it has to get digested, absorbed into your blood, processed by your liver, and filtered by your kidneys before it ever even gets to your bladder. So much can change on that journey. And that's exactly why a cool study like the one on thyme is promising, but it's not proof that it's a cure. And here is a perfect real-world example of that gap between the lab and real life. Uva ursi, one of those traditional herbs we mentioned, was put to the test in a human trial in 2019. The result? It was no better than a placebo, a sugar pill, at making people feel better. It's a classic example of a remedy with a strong tradition that just didn't hold up when tested in people.
And this brings us to what might be the single most important point here. Just because something is natural does not automatically mean it's safe. Unlike the drugs you get from a pharmacy, herbal supplements aren't strictly regulated for safety or purity, or even if the dose on the bottle is what's inside, and they can have some really serious side effects.
Let's just take horsetail, for example. It's often sold for urinary health, but just look at this list of warnings. If you have diabetes, it could mess with your blood sugar. If you have low potassium, it could make things even worse. This is not a harmless little plant for everybody.
And parsley? We put it in our food all the time, but in concentrated medicinal amounts, it carries some serious warnings. If you have kidney disease or a bleeding disorder, it could be genuinely dangerous. This is exactly why you can't just self-diagnose and start taking this stuff on your own.
Okay, so we've looked at the tradition, we've seen some cool science from the lab, and we've gotten a pretty big reality check. So what's the takeaway? How are we supposed to think about all this?
Well, here's a really smart way to approach it. 1. Yeah, acknowledge the potential. That time study was interesting. 2. Question the proof. Ask, where are the big studies in actual people? 3. Prioritize safety. Know the potential side effects. And all of that leads to number 4, the most important one. Talk to a professional. Never ever replace real medical advice with an herbal remedy you read about online.
And this, right here, is the bottom line. The expert consensus is clear. Herbs might be useful alongside conventional treatment as a complementary therapy, but they are not a replacement for proven medical treatments like antibiotics that can clear up an active, painful infection. That distinction is everything.
And that kind of leaves us with a final thought to chew on. Maybe the whole debate isn't about choosing a side, nature versus science. What if the real future of health is finding a way to bring them together? Taking that ancient wisdom, testing it with modern science, and figuring out what's safe, what's effective, and how we can use the best of both worlds.